Hi there. I'm Dr. Sheba Roy, and this is my colleague, Dr. Jeffrey Mensa. And we're with Associates of Integrative Medicine in Michigan. We are what's called naturopathic oncologists, or another term for that is integrative oncologists. In the state of Michigan, we call ourselves supportive care to oncology, so as to avoid the confusion that patients may feel in an unlicensed state. And today we're going to talk a little bit about what those terms mean and what our training is, so that we can give you some background that may be useful in kind of navigating the terrain of natural medicine and nutrition in cancer care. So, when we're talking about naturopaths in general, naturopaths are just really good primary care doctors, naturopaths that went to a 4 year or 6 year accredited naturopathic medical school. In the state of Michigan and in other unlicensed states, anybody can call themselves naturopaths, holistic, integrative. It doesn't really mean anything. Anybody can call themselves a doctor. And that means that someone who has done a certificate program can also call themselves a naturopath or a naturopathic doctor, or someone who is self-trained in herbalism can call themselves a naturopath or a naturopathic doctor. We are not herbalists. Dr. Mensa and I are not homeopaths. And what that means is we aren't skilled in just one tool in natural medicine, and both of us have gone to medical school. We are trained in a very different way, in an intensive way. Now, that's not to say that someone who's an herbalist or someone who's trained through, let's say, um, their tribe or their people or their folk or their kin folk are not excellent healers. They may be excellent healers, and they may be excellent healers even in this space. We're not here to say one is better than the other. We're here to say what our training is and why it works in this field for our patients. Um, and to help you to clarify who you're seeing. So, when we're talking about a naturopath in our world, we're talking about someone who's gone to one of 7 accredited naturopathic medical schools, which means they had a conventional medical training background in addition to training in natural therapies. And what these graduates are primary care doctors who usually practice in licensed states. So I hold a license in the state of Vermont. And Dr. Mensa, where do you hold your medical license?
Vermont. Mhm.
In Vermont as well. So in the state of Vermont, we would be able to prescribe drugs and do all of the things associated with primary care, minor surgical procedures, sometimes deliver babies, things like that. In Michigan, we act as consultants to oncology. Um, Naturopaths, who are primary care doctors, are really excellent at looking at all of the things that drive patients to a primary care doctor: colds, flus, digestive issues, hypertension. And for this reason, in naturopathic medical school, almost all of the clinical hours, of which there are about 1,500, focus on what we would call primary care. And that's why if you're looking at websites of different naturopaths, you're going to see like a whole hit list of things that they treat. And that's because they kind of treat anything at a basic level, just like a good primary care doctor would. Um, they just are primary care doctors with a big toolbox. So their toolbox includes drugs, but it also includes botanicals, nutrition, energetic medicines, things like that. In our case, um, we are specialists, and to become a specialist in the field of naturopathic medicine is fairly difficult. So, a specialist in whether you're an MD or an ND is someone who went on from that primary care background to become further expert in a specific field or a specific part of that field. Um, So, in addition to your basic training, like a kidney doctor, for example, would do their residency in internal medicine, but then would do a specialty in kidney care called nephrology to become a nephrologist. And if they were to become a specialist in a small part of kidney medicine, they might subspecialize with additional years of training. So in our case, or it's much harder to specialize because those clinical years, excuse me, are about primary care. So we're usually doing those 1,500 hours in only primary care. So to become a specialist, you have to be motivated while you're in medical school to seek out clinical hours in the specialty that you're interested in. So, Dr. Mensa, maybe you can just talk a little bit about some of the specific clinical rotations you did so that you would have more exposure to chronic illness and oncology.
Right. So, depending on where you go to school and also depending on the naturopath that you see, like rotations can look like any of the following. You can find people who have done rotations in gastroenterology. That means in their clinical hours, they did a focus under supervision with just gastrointestinal cases. So, anything from the abdomen that's right underneath the rib cage to your pelvis. Other times, you'll see naturopaths quite often go on to an endocrinology focus. That's anything with your hormones or the chemical signals that are moved through your body. You also will find people who do chronic illnesses. That can be autoimmune disease, Lyme disease, congenital conditions from birth. And what that means is they are in their clinical rotation. And again, they take a specialty, an affinity to, and then, as Dr. Roy said, a motivation to seek out those specific types of cases to become experts. Okay. Now, after that, sometimes when you finish those clinical hours, you can go on and specialize in those spaces. So let's say if you saw someone in endocrinology, and then they said, well, after I did these hours on my clinical rotation, I then went on and did a advanced focus, where now I'm taking everything that I learned as that specialty in primary care, and then I combined it and then really focused in on endocrinology. So thyroid or adrenal health and so on and so forth. The same thing would be said for myself and Dr. Roy. So we have those clinical rotations, we have those residency hours. And then after that, we said, now that I've been had some type of exposure to cancer care, I want to take that cancer focus and really get specific and detailed and skilled in those things.
So the difference would be for MDs that they have twice the number of clinical contacts that NDs do, but those are with typically very ill people. And it's not a lot of that contact is in primary care. So in your basic training, meaning in medical school as an MD, you're heavily exposed to specialty care and very ill people in a hospital setting, but underexposed to primary care. And for an ND, you're heavily exposed to primary care, but underexposed to very sick people in a hospital setting. So if an ND wants to specialize, they have to do additional clinical hours in the field that they're interested in prior to applying for a residency and fellowship. So, following medical school, anyone who wants to specialize needs to do an additional set of years of training. And in our case, I did my residency in internal medicine at St. Joe's. And I think Dr. Mensa simply concentrated his hours in internal medicine in Chicago. And then both of us did fellowship. Fellowship is a usually a 2 to 4 year program where it's the years that you, as Dr. Mensa said, where you concentrate your knowledge in a specific field. So both of us are fellows, have in naturopathic or integrative oncology. Um, for MDs, they would when they finish medical school, they can do 3 years in pediatrics, family medicine, or internal medicine. Those are the basic fields of medicine. And then to specialize, they would have to do an additional 2 to 4 years, sometimes just 1 year, to specialize in a specific field. So it's not that different. The difference really is when you get the exposure, whether it's during your medical school training or afterwards. And there's not a huge difference in the amount of time that it takes to complete it. Most naturopaths do not do a 3 year residency after medical school in internal medicine, pediatrics, or family medicine, because for pediatrics and family medicine, those are primary care specialties, and they're getting those hours during their medical school training. And for internal medicine, they don't have the grounding or foundation to know what's going wrong in an organ system to be able to go on and do a residency in internal medicine without having done those clinical hours prior. So I happen to be lucky to be able to do a residency in internal medicine, and it's because I had a strong relationship in Detroit with a tertiary hospital that offered that residency opportunity. Um, Moving on from there. So we're using a lot of big words here, but basically what I want to do is kind of show you a table right now that compares the training between an MD and an ND, or let me put it better, between a FABNO, which is what we are, a fellow of the American Board of Naturopathic Oncology, and a medical oncologist. And I think that will help you to understand not that we're in competition with each other, but how we're partnered together and how we speak the same language in some ways, which allows us to partner together well. So if you look at this table here, to become a FABNO or a medical oncologist, you need to do 4 years pre-med. And then you have entrance exams. Usually it's an MCAT for a med-oncs, and for us, it's a GRE or an MCAT. Those are just placement exams. In medical school, you have 2 years of basic science as a med-onc. As a FABNO, you have 2 years of basic science plus a year of biochemistry, a year of pharmacognosy, which is the interaction between the pharmaceutical nature of plants, like how the pharmacokinetics and the metabolism of botanicals and how they interact in the body, and a year of pharmacology. Then you take another set of placement exams. So for FABNOs, that would be the NPLEX step 1. For med-oncs, it would be very analogous, the USMLE step 1. For medical school in your year 3, you have your first year clinical as an ND, and same thing with an MD. In your clinical years as an ND, you have a year of health behavioral counseling, a year of clinical nutrition, and a year of botanical medicine in addition to your primary care hours. And in medical school, you have month-long observational rotations only, in internal medicine, family medicine, general surgery, psychiatry, neurology, pediatrics, OB/GYN, and emergency medicine. So the difference here, as you can see, is the focus on primary care in an ND setting and the focus on specialty medicine in an MD setting. And the other big difference is the ND in this setting is treating the patient. In the MD setting, they're observing the patient, which is why a residency post naturopathic medical school in primary care would be redundant, because you're getting that intensive training at far more hours than you do on this side of the bench. In your 4th year, you still have that year clinical primary care, plus a year of physical medicine, a year of energetic medicine. And on the MD side, only specialty month rotations, which are observational only. You can add 1 to 4 month long rotations in oncology as an ND if you are considering becoming a FABNO. Both sides are interviewing at this point for specialty training. And then you take your next set of placements exams, which are step 2s in both. For NDs, we have to take state licensing exams, which include pharmacology and ethics. And we are at this point licensed to practice primary care medicine in the states that we're licensed. MDs are not licensed at this point because they need to move on and do the 3 years of internal pediatrics or family medicine in a practice setting, which they didn't get during their school curriculum. NDs can move on to do 1 to 3 years in internal medicine optional. They don't have an entrance exam to practice because they've already been in practice during this time. MDs do. And then on the left side of this table, which is the ND side, we're already licensed, but this part here where we take these state licensing exams, this is the point at which MDs take them. We both then catch up with each other and do a 2 to 5 year fellowship in oncology. We both take a set of national board exams. Ours are focused on evidence-based and evidence-informed natural therapies as supportive care to oncology consult. Theirs are focused on primary treatment for cancer using chemotherapy, radiation surgery, and immunotherapy. These are the letters following our name. These are the letters following theirs. And our jobs are very different. So, Dr. Mensah, if you could just quickly go over what our different purviews are here.
Right. So with your conventional oncologist, they're going to be, depending if they're your surgical oncologist, medical oncologist, radiation oncologist, we can talk about the medical oncologists who would be prescribing your chemotherapy. Their job, their primary goal is to fight this disease. And the way that they're going to be doing that is giving you these chemotherapies or immuno or targeted therapies. Their goal is to achieve a no evidence of disease. Once we get to that cure on their end, their prerogative at that point is to lower your risk of recurrence. Now, let's say if you're at stage 4 disease, their goal at that point is going to be to slow the progression of your disease. Best case scenario, if they can get you to no evidence of disease at stage 4. And then ultimately to mitigate pain. Now, that's going to be a little bit different for the FABNO because primarily when we're in this supportive care field, what we want to do is the following. We want to prevent the side effects of your treatment. The reason why we want to do that is because we want the most effective outcome for you, getting the maximum dose of chemotherapy for this best outcome, getting the maximum dose of radiation for this outcome to lower this risk of recurrence once you are cured. Okay. We want to protect your healthy organs. So if you have, let's say, breast disease, your chemotherapy, your radiation might be affecting other organs like your lungs or your heart or your digestive system. Our job then is to protect these healthy organs that have nothing to do with your initial diagnosis, right? To get you to the other side of treatment. Okay. We then are going to apply these naturopathic principles, treating the whole person. What that means is we're going to address your sleep, how that's affected through treatment, your mood and emotional disturbances, your relationship with food, sexual dysfunction, bowel changes, and then also how your body might be confused and how to use fats and sugars through your nutrition and diet. Okay. Now, in states that we are licensed, we that can look like any number of things. One that can be off-label drug use, right? That also can look like IV therapies, like high-dose IV vitamin C. Okay. We do this as adjuncts, as in with your treatment, because that goal is to boost the effect of that chemotherapy and boost the effect of the radiation. Once we're finished with that piece in your journey, we want to prevent your risk of recurrence. And also, if you are in that stage 4 disease category, slow that progression down. Okay. We also have ways to combine with our conventional oncologists to mitigate pain. So that can look like any number of things. That can look like cognitive behavioral therapy. That can look like breath work. That can be like nutraceuticals that we can combine safely and effectively with pharmacological therapies from your conventional oncologist. Making sense?
Yeah, and I think that um, that's really helpful. So I hope that that was helpful for you guys as well. Call us at 248-798-2942. That's 248-798-2942. 2942, or you can always go to our website, which is Associates of Integrative Medicine, natural.com. That's aimnatural.com. If you go to aimnatural.com and you clicked on the contact us page, you can send a message to us there, and we'll usually reach out to you within 2 business days. If you go to the bottom of this website, right here, there's a little video link that you can click on that this video will be posted on. It's our YouTube channel, and there's a bunch of other videos here that where we talk about other topics like sex, sleep, food, to give you a better sense of how to fight this journey. We are with you until we speak to you. We hope you are well and you be well.